This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Afternoon. Reminder to maintain audio quality. Keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-designee Andrea, and available to answer questions are Traci DeSalvo, the Acting Director of the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel for the Office of the Governor. We'll begin the briefing with remarks from Governor Tony.
Good afternoon, everybody. Thank you for joining us. I would like to start today by thanking the countless volunteers, clerks, election officials, members of the National Guard, and voters who made Tuesday's election such a great success. Whether folks voted in person or by mail, local election officials and volunteers worked diligently and thoughtfully to ensure that every Wisconsinite was able to make sure that their vote was counted and their voices were heard safely. In support of these efforts, nearly 700 citizens, soldiers, and airmen of the National Guard supported polling places in 40 counties across Wisconsin. And that's in addition to the nearly 1,100 members already mobilized in our COVID-19 response efforts. I'm incredibly grateful to all the folks who pitched in to make sure democracy prevailed even during these unprecedented and challenging times. That said, the November general election will be here before you know it. So make sure to make a plan to vote and request your absentee ballot by myvote.wisconsin.gov. Unfortunately, however, on Tuesday we also hit another mark in this pandemic. It is with heavy heart that we announced that in just over 6 months, Wisconsin's COVID-19 death toll has surpassed 1,000 people. Even one death from COVID-19 is one too many. This is a devastating milestone, and every corner of Wisconsin has felt the tragic impact of this virus, as 52 of Wisconsin's 72 counties have reported at least one COVID-19 death. We also know this virus has a disproportionate impact on communities of color, with Black, Latinx, and Indigenous Wisconsinites having higher rates of COVID-19 infections and deaths. The infection rate for Latinx Wisconsinites is over 5 times that of white Wisconsinites, and Black Wisconsinites are experiencing a death rate over 4 times higher than their white counterparts. To all the Wisconsinites dealing with the loss of a family member, friend, a coworker, or a neighbor, I express my deepest condolences. Know that our hearts and thoughts are with you. and we are going to continue doing everything we can to fight this virus that has already taken the lives of so many people across the state. Finally, as we continue to navigate the COVID-19 pandemic and continue to work on Wisconsin's economic recovery, we want to ensure that we are providing transparent and up-to-date information on how and where we are investing Wisconsin's share of federal funding. That's why today I am happy to announce that we are launching Wisconsin's COVID-19 Response and Recovery Investment Dashboard. This website will allow Wisconsinites to see for themselves how our investments, totaling $1.73 billion so far, are helping your neighbors and communities, from our $200 million Roots to Recovery initiative to the $25 million Wisconsin Rental Assistance Program to the $50 million Wisconsin Farm Support Payment Program. In just a few short months, we've been able to put more than 10 million pieces of personal protective equipment and more than 1 million testing and lab supplies into the hands of local communities and our tribal partners. We've also invested in more than 12,000 small businesses and provided an additional support to nearly 12,000 Wisconsin farms. And folks, the impact of our investments keep growing. So visit www.doa.wi.gov and click the Response and Recovery Investment link to see how we're investing in creating a Wisconsin that works for everyone. Folks, it's on each and every one of us to do our part to stop the spread of this deadly virus. For the health and safety of our friends, family, neighbors, and fellow Wisconsinites, it's really important. Please continue to stay home whenever you're able. Limit your social service and limit your social circle and practice physical distancing, and wear a mask whenever you are out. Working together to box in this virus can and will save lives. So let's do this together for each other, Wisconsin. Now, I'd like to turn it over to Secretary-designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. Box in the virus, stop the spread, flatten the curve. Those of us working in public health have been using these phrases for a while now, but I know that they've only become a topic of more general conversation in recent months. And because we've grown accustomed to them, it's easy to use them without really thinking about what they mean and what they tell us about where we are in this pandemic and how we can make decisions that are the safest possible choices. So I want to take just a moment to expand on them. When we talk about boxing in the virus, we're talking about identifying where the virus is and making sure that it stays there. That means we're talking about testing, tracing, and isolation and quarantine. In Wisconsin, we have critical in-state lab capacity, so if you have symptoms or have been exposed to COVID-19, please get tested. And we have some important news to share today about our testing efforts. Through funding from the Federal CARES Act, healthcare providers, as well as their local and tribal health department partners, can apply for reimbursement for testing. The $45 million allocated for the COVID-19 testing payment program will help remove barriers by providing financial support to organizations staffing up local testing, and in turn, increase access to testing across the state. Contact tracing is also integral to boxing in the virus. Once someone tests positive, they need to be contacted to advise them on their need to isolate from others and to determine who else needs to be notified of a potential exposure. At the state level, we have 229 employees working to assist local and tribal health departments with contact tracing. And our local and tribal health department partners have 1,128 staff available to work on contact tracing, with an additional 182 staff trained and ready for potential surge response at the local level. When you test, when you answer the phone call from a contact tracer, and when you isolate and quarantine as necessary, you are boxing in the virus. This is a collaborative effort between DHS, local and tribal health departments, healthcare providers, and the residents of Wisconsin. So in stopping the spread, we each stop the spread when we stay at home and limit our trips to the essentials, when we wear a face mask, when we practice social distancing, and when we wash our hands for at least 20 seconds. When each of us takes these actions, each of us is doing our part, and we can all stop the spread of COVID-19 together. Doing our part at DHS includes giving you the most up-to-date data. Here are where things stand today. We have 1,035,195 negative tests, which is an increase of 11,472 over yesterday. There are now 63,206 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 943 over yesterday. Our total deaths have now reached 1,018. I know our numbers can feel discouraging, but we flattened the curve before, and we can do it again. By boxing in the virus, by stopping the spread, we can reduce transmission, and that is how we reflatten the curve here in Wisconsin. Thank you.
Thank you. And we'll open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please only one question per reporter per media outlet. And we'll begin today with Todd Richmond from the Associated Press. Todd? Todd Richmond? And a reminder, *6 to unmute your phone. Okay, we'll move on then to Kent Wainscott from WISN-TV in Milwaukee. Kent?
Hi. Kind of a two-part question about hospitalizations. I'm wondering if you can explain the dramatic swings that we've seen in hospitalization numbers in recent weeks in the Southeast region. And now the Washington Post is publishing statistics that show Wisconsin with the largest week-to-week percentage increase in hospitalizations in the nation. Is that accurate? And if so, how do you explain that?
So as it relates to the first part of your question, we did receive new requirements from the U.S. Department of Health and Human Services for reporting hospitalizations a few weeks ago. And the increased data requirements and the time that it was taking for hospitals to gather that data and be able to respond, I think certainly is linked to the fluctuations that you have seen in our data as we have reported it over the last several weeks. We have been working with our hospital partners and have provided an automated solution so that our portal, which they report to us, and the portal that they report to the feds, is better able to connect to each other. And so what you're seeing now on our website is accurate, is up to date, and certainly tells the story on a daily basis moving forward of what's happening with hospitals here in the state of Wisconsin. So we really do appreciate the partnership with hospitals as we have all worked together to pivot to these new requirements that have come to us from HHS. On the Washington Post article, I will say that I have not seen it. So if we could put a pin in that, we'd be happy to respond to your question, but I think we're going to need a minute to take a look at the article.
Thank you, Kent. Now to Amy Reed from News 3 Now in Madison. Amy?
Hi, my question's for the governor. We're seeing a spike in gun violence this week. An 11-year-old girl was shot in the head in Madison and was taken off life support this morning. What's your reaction to this spike in violence and this death, and what would you like to see from government in response?
Well, certainly any kind of gunplay is unacceptable, and it's just made more real and more heartbreaking when it impacts a bystander and when it impacts an 11-year-old little girl. And clearly that's unacceptable behavior. We need to take a deep breath as a state, as a country. I think the increase in gunplay is a national phenomenon, and it it talks to me about the need to, frankly, make sure that we have the gun safety legislation in place. I think that's important. That may not have saved the life of that little girl, but we need to continue and have discussions about gun safety in our state and our nation. We tried unsuccessfully to get that conversation going with the Republicans. Hopefully, at some time in the future, we can. But it takes all of us to figure this out. I mean, it is yes, we need to arrest the people that do these actions, but we also may have to make sure that access to guns is not so easy that anybody can have one at any point in time. We need gun owners in this state, and the vast majority of them are good Americans that keep their guns safe, but we need to find ways to get the guns out of the hands of people that are using them unwisely.
Thank you, Amy. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor? Victor from CBS 58? Okay, we're going to move on then to Sean Kirkby from Wisconsin Health News. Sean?
Hi. Hi, thanks for taking my question. I was wondering, in the early weeks of the pandemic, the Department of Health Services had put out a projection showing around 400 to 1,500 deaths in the state and about 20,000 confirmed cases of COVID-19. I was wondering, has that projection been updated, and what are you guys projecting now for what the death toll and case count could be in the state in the next few months or so? Thanks.
Thanks, Sean. We have not done additional internal modeling on this question. There are a number of think tanks and universities and other COVID-specific projects that do lots of modeling, and so we certainly look at the projections that others are making, but we have not internally done additional updates to that model that you're talking about.
Thank you, Sean. Now to Katie Anderson from WBAY TV in Green Bay. Katie? Again, Katie Anderson from WBAY. Okay, we'll move on to Natalie Sapila from WAOW TV in Wausau. Natalie?
Hello. So Senator Tammy Baldwin recently wrote a letter to the Vice President challenging him to act in the wake of COVID-19 testing supplies being diverted from the state of Wisconsin by the federal government. And I've been speaking with local hospitals who have talked inconsistencies with which they've been receiving testing supplies and how they're really seeing that impact at their level. And so with Wisconsin being, one of the states that's considered a hot spot for COVID, what is being done at the state level to solve this issue?
We have heard a number of our hospital partners that they have had supplies of reagent needed to do testing diverted to other parts of the country. I think in addition to Senator Baldwin's call to the Vice President, which you just mentioned, the governor has sent a number of letters to the manufacturers of reagent that we use and need in various places, various labs around the state. And we continue certainly to talk with our partners about how we diversify our supply, how we increase our testing capacity to find additional alternatives to get around some of these supply chain problems. But this is it's a similar refrain. We have seen diversions earlier in the pandemic. We have seen problems with supply chains as it relates to PPE, as it relates to testing supplies. It would be I think, incredibly helpful for per the senator's letter for there to be a national strategy around supplies and manufacturing for these critical pieces of our response to the pandemic, so that we're not competing with every state in the union who is also seeing a surge in testing demand, because that's right. That is certainly an inefficient way for us to be scrambling to find the things that we need to be successfully responsive, again, in competition with our with states around the country who are just as urgently trying to meet the needs of their citizens. So I think we need our federal partners to help us make sure that we have the supplies in the state of Wisconsin that we need to protect our citizens.
Thank you, Natalie. Now to Hannah Jewell from Fox 6 in Milwaukee. Hannah?
Hi, my question is for the governor. We have a lot of people in the Milwaukee area very appreciative of the statewide mask mandate. As some are preparing to go back to school in person in only a few short days, some of our viewers are wondering, are you currently considering any additional statewide safety restrictions at this time pertaining to schools or in general? Thank you.
Well, pertaining to schools, I spent a fair amount of my time over recent weeks discussing what reopening looks like all across the state of Wisconsin, and it's different depending on where you are in Wisconsin, and for some very legitimate reasons. Mitigating the ability to mitigate social distancing can happen easier when you have fewer kids, and so there are several rural school districts that are reopening in person, but they're also, to their credit, offering a remote option for parents who feel uncomfortable about doing that. So I just think the discussions that are happening locally, and I've talked to lots of teachers, principals, superintendents, and board members and community members around this, and there is good conversations going, and I at this point in time, I don't see the need for any kind of order, possibly some more guidance, things to look at, but the Department of Public Instruction and with our Department of Health Services and Department's Children and Family sent out guidance that talked about the different options that are that people should consider, but also the types of questions that need to be asked and answered before reopening in any format. So at this point in time, there seems to be good discussion going on, and I believe good decisions are being made.
Thank you, Hannah. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thanks for taking the call. My question about testing supplies is answered, so I'll pass.
Okay, thank you, Jonathan. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yes, thank you. I was hoping, and this answer is for this question is, I guess, for anybody who has the answer. Have you heard anything from either district attorneys or police forces, sheriff's departments from across the state in regards to how the enforcement of the mask mandate has been going?
I can answer that. So we work very closely with the Wisconsin Department of Justice in order to provide guidance to district attorneys, and we continue in the Department of Health Services is working very closely with local public health officials on enforcement of the mask order. And I'd say, overwhelmingly, we've gotten a lot of positive feedback. I think if you look at the Marquette University law poll from the other day, 69% of the state supports the face covering requirement. And I think, as we mentioned when this was first announced, that we're hoping that people voluntarily comply with it. If they aren't complying with it, we hope it's an educational opportunity. And I think that's exactly what you've seen across the state. And so we're going to continue doing outreach with our local partners on this, but we think folks at the local level, especially our public health officials, are doing a very good job in terms of educating the public and working with their local partners on making sure people are doing the right thing and masking up.
Thank you, Rob. Now to Babs Santos from WLUK TV in Green Bay. Babs?
Hello, my question is for the governor. Following the president's recent executive orders promising another $400 a week in unemployment benefits for Americans, states will be on the hook for paying 25% of that. And I'm wondering, Governor Evers, can Wisconsin afford to pay that, and will Wisconsin pay that?
Yeah, and that's a great question. We're reviewing those orders now, and frankly, even from the time the president announced it at his golf course to today, the story has changed somewhat. It's changed a lot, frankly, and so we're continuing to review these orders. Among us, I think this could be more readily and more logically solved if the president and the Congress got their act together and passed some legislation. When you're dealing with this specific executive order, the fact that some of the requirements that were once thought were requirements now aren't, and so we're continuing to review that at this time. Our goal is that to make sure that people that are unemployed get the money they need to survive. That's the bottom line. And one would think that that really important bottom line would compel people to come together in D.C. and actually pass a bill.
Thank you, Babs. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you very much. I'm wondering what what your thinking is on the current success of the mask mandate, in terms of are the numbers yet indicating that it's making a difference, or what time frame do you think you're going to need to see whether that has made a difference? Thank you.
I'll turn this over to Secretary Palm in a minute, but anecdotally, I think it has made a difference. We've had business owners who require, especially retailers, who require masking to have kind of additional help from the state in requiring that. And that seems to have worked not only for the business community, but obviously it works for us. Additionally, I've heard anecdotally from school districts that we're concerned about the number of parents who were refusing to mask up their kids in order to open schools, have now decided that they would mask their children up. So that's just the anecdotal piece. I don't know if you have any thoughts about how long we wait for making a determination.
Yeah, so I think right in context, we released our weekly update to the disease activity levels across the state on Wednesdays, and while we certainly are pleased to see 11 counties with their trajectories on the decline, we still have 6 counties that are on the incline in their trajectory, and right, that leaves the remainder of the counties which are holding pretty steady. But we have high activity level of COVID-19 across this state, and so I think the governor's absolutely right. It does make a difference. It has made a difference. But now is not the time. We cannot take our foot off the gas on this one. We've got to get to a place where our trajectories are consistently going in the right direction, where we are seeing counties and communities across this state having disease activity levels that are going in the right direction, that we're going from high to medium to low, so that we are reducing transmission as much as we can to keep as many people safe and healthy as possible. I don't know if you want to say anything more specifically, Traci?
I think the only thing that I would add is that remember that the incubation period for an individual with COVID-19 can be up to 14 days. So it will take us a little while to start to see that decrease in cases that is coming from the masking order.
Thank you, Eric. Now to Tony Langfellow from WSAW TV in Wausau. Tony. WSAW. Okay, moving on then to David Wahlberg from the Wisconsin State Journal. David.
Hi, thank you. Governor, given that a fair amount of the recent cases of COVID in the state have been among young adults, and some faculty and union members, staff members at UW campuses are expressing concern about reopening campuses, I'm wondering, do you support the reopening of UW campuses to students at least partly in person in the fall?
Well, I think the UW campuses, UW system are in a better position to make that decision. They, especially our higher education institutions, have all the research available for them. They also have all the data that our great Department of Health Services provides to them, and so they're obviously thinking through these things and making decisions on a daily basis. They just made some decisions around their athletics in the last couple of days, and I know that all the campuses are gearing up as it relates to testing and contact tracing that needs to be done in order to keep people safe. So it's an ongoing discussion, and we're actively involved with them. I believe they're in a position to make the wisest decisions.
Thank you, David. Now to Rachel Glass from TMJ4 in Milwaukee. Rachel?
Hello. My question has already been asked. Thank you.
Okay, thank you, Rachel. Now to Nate Phelps from Spectrum News. Nate? Nate Phelps from Spectrum News. Moving on then to Jeremy Janine from Urban Milwaukee. Jeremy?
Question for the Secretary-designee. About 2 weeks ago, you said in the fall the state needed to hit about 100,000 tests a week. It was like you could quickly see into the future because we trended really closely to that. Now there's been a sharp downward trend in the number of tests on a 7-day average. Is that a reduction in demand? Is that the supply issue? What's going into that?
So I think broadly I would say that we do continue to think that expanding our capacity for testing here in the state of Wisconsin is a critical thing to continue to do. We do expect, as we saw in the surge that we have had over the last, in the month of July, that we had testing demand that was coming very close to the capacity that we have here in the state of Wisconsin. And so with some of these reagent diversions that we have heard about and some of the supply chain issues, we are tracking very closely our lab's capacity. And again, it only speaks to why it's important that we have signed additional partnerships with additional labs to bring more capacity on board. It speaks to why it has been so critical for us to build as much in-state capacity as we can. We have done really important work to keep our testing turnaround times low so that once we have a result, we can go directly to contact tracing so that testing is actually really meaningful here in the state of Wisconsin. But we've got to continue to build that capacity and do everything we can to make sure that the supplies that are necessary to run those tests are available here in the state of Wisconsin. And again, I think as Senator Baldwin's letter asked for, and as the governor has asked the feds and the manufacturers of these products, we really need our supplies not to get diverted to other parts of the country. We need to be able to take care of the citizens of Wisconsin with the kind of resources that are necessary to successfully respond to this pandemic. And these diversions are unhelpful to our efforts. But right, we are competing with states all across the country for reagent and other testing supplies that, just like we have previously been competing with folks for PPE. So this is a similar issue, and it's been an ongoing problem throughout the pandemic, and we really do need our federal partners to help smooth out these supply chain issues and for there to be a national strategy, a national effort to make sure that states across the country have what they need to respond to this pandemic.
Thank you, Jeremy. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, thanks for taking my call. I was just wondering, you guys kind of talked a little bit about DPI, DHS, and DCF sending guidance on what to consider in regards to reopening. But I'm wondering if you can tell us what is the guidance that DHS or, these organizations are giving to school districts if there are positive cases at school or a spike in cases in schools.
So I think the guidance that the governor was referencing was guidance that we did with DPI earlier June, I think. It could have been a little earlier. Sorry, I lose track of time. So we are continuing to work with local public health, with DPI, with our partners to make sure that we're available for technical assistance, other guidance needs, so that schools have what they need moving into the fall and through the winter as it relates to decisions they'll need to make if and when they see positive cases in their schools. I don't know, Traci, if you want to say anything more.
I think the other important thing to mention is that we just want to remind everyone that if you have the symptoms of COVID-19, you should stay home and certainly contact your family physician and get tested. But it's really important for anyone, schools or otherwise, to really remember to stay home when you're sick and practice your good social distancing, wearing masks when you're out in the public if you are well.
Thank you, Danny. Now to Chuck Quirmbach from Milwaukee Public Radio. Chuck?
Good afternoon. Excuse the informal use of last names, but Trump and Pence are coming to Wisconsin next week. Biden and Harris are not. Who's right from a public health perspective? And Governor, can you give any more details of whether you're going to speak in Milwaukee for the DNC or speak from Madison, please?
Great. Those are a couple of questions that we'll bend the rules on. The first one is who's right, who's wrong. Here's what is right. If President Trump and Vice President Pence and the women for Trump and whoever else from the Republican side is coming to Wisconsin next week, they have to wear masks if they're in buildings. They have to make sure that their audience is physically distant from each other. We can't afford to have these events make it more difficult for us to prevent the virus from being transmitted in the state of Wisconsin. So my expectations is they're masking up. They're going to follow the order, and that's our expectation as a state. As it relates to me personally, I will be speaking in Milwaukee on one of the 4 days. I can't remember which one, and not from Madison. I will actually be in Milwaukee, but it is. I've been assured that the venue is all the things I just talked about: masking up, making sure that people are that there will be no people in the audience. It'll be whatever media is in the room, and that everybody is safe. So. I feel comfortable with that opportunity.
Thank you, Chuck. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Thank you for taking the call. Kind of jumping off something that people mentioned earlier. Tammy Baldwin questioned Mike Pence on the diversion of COVID supplies from Wisconsin, but I emailed with a representative from Brian Sal's office today who said that they believe that, at least in the case of Advocate Aurora, that there appears to be a conflict between Aurora and their testing supplier. Can you clarify whether the redirection of supplies was A, at the behest of federal decision makers, or if B, it was the decisions from suppliers? Thank you.
So I don't have visibility specifically on Advocate Aurora's supply chain issues, whether anecdotally that is one of the diversion issues. So you'll have to ask them about that. But we have heard from a number of our partners that they have received reduced amounts or no amount of reagent that they had been expecting over the last several weeks, which has reduced the number of tests they are able to execute on here for Wisconsinites.
Thank you, Adam. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Thanks for taking the time here. Governor, it looks to me like you've got about $300 million left in CARES money to appropriate. What is your plan for that money? What are you thinking at this stage as to how you want to spend it?
The obvious one, Patrick, and we want to make sure we do the right thing, so it has not been completely allocated, but testing and contact tracing will continue right up until December 31st, and it'll hopefully ratchet up as we move forward. And so clearly, the basics that we've laid out right from the beginning is contact tracing, testing, and it costs money, and we will do everything in our power to make sure that we continue to do that. That is the overall first priority.
Thank you, Patrick. Now to Caroline Peterson from NBC 15 in Madison. Caroline?
Thanks for taking the questions. Kind of going off the mask mandate timeline question, what happens, and I'm curious to know maybe the governor's thoughts and DHS, if we don't see a change in numbers kind of after we hit that official 2-week mark and past that. I know you guys said the 2-week incubation period is kind of what you're monitoring.
Well, certainly we believe in masks and masking, and so I can't imagine that after that 2-week stance or period of time that we're going to say, well, it hasn't worked, therefore don't use a mask. So we will continue to do that. We also need to continue to, frankly, and I say this in the most basic way, we need to make sure that people don't hang out in small places with a whole bunch of people and nobody has a mask, because somebody's going to walk out of that room with COVID-19. So that's one of the issues we have to figure out. We need help from the businesses. We need help from the business community in general. But that is critically important. That is where we're seeing a lot of the transmission of diseases. So we will look whatever we can to make sure that we have all the pieces in place to drive this virus down.
Thank you, Caroline. Now to Will Cushman from WisContext. Will?
Good afternoon. My question is for Secretary-designee Palm. I'm curious about one of the data points that the Department of Health Services shares on its outbreak page related to COVID-19, and that's the one about recovery status of patients in the state. And my understanding is that recovery status does not necessarily indicate that all of these patients have all of their symptoms completely resolved. It simply means that they are deemed to be no longer infectious. And so I just want to double check that understanding is correct. And then also, I'm curious as to why the terminology for recovery is used in this instance. Then it seems like it could be a little bit confusing. And I apologize, this is a multi-part question, but I have one last part of the question, and it's I'm curious as to why the state does not release this data historically. Like why only the current day's data regarding recovery status is available and not going back in time like other data points. Thank you very much.
Sure. So I'll say a few things about this, and then I'll ask our epidemiologist to weigh in on the science piece of this. But I think sort of contextually, one of the things, as we have tried throughout this response to provide the kind of data that people are interested in seeing, that they've been asking for, that helps really tell the story of what's happening here in the state of Wisconsin as it relates to COVID-19. One of those requests early on in this outbreak was about folks who were recovered, and I think it was an important and a good ask, and one that we wanted to be responsive to because it provides information about, to your point, the number of active cases, the number of people who are infectious, the number of people who could be transmitting the disease is different than the cumulative number of people who have tested positive over what is now 6 months of a pandemic. And so that recovered number really does help you contextually understand what the status of the disease is, and it's not just a total number. And so I think that really is important information. It gives you a sense of, again, what's active and therefore infectious, and what is past that point. And we wanted to make sure we were providing that kind of information to the public so that they could factor that in as they were thinking about their own decision-making, their own choices, the things that they were considering as they were trying to keep themselves and their family safe. So I think the other thing that Traci may also want to speak a little more specifically to is, at the time that we named it and that we posted it on the website, was, I think, certainly before we understood the full, and we're still learning, right? We're still learning about this disease, about symptoms, about the long tail that it has for some people as it relates to it lingering, the fact that sometimes you can recover from symptoms and then they will flare back up again. So, right, we're still learning a lot about what it means to be a positive case of COVID-19. And so recovered was certainly the right word at the time. I think our knowledge and understanding of the disease has evolved and will continue to evolve. But I will let Traci speak specifically to the question of infectious versus symptomatic.
Sure. Thanks, Secretary Paulman. Thanks for providing that great background. And you're absolutely right that one of the things we're seeing, and of course, is that not everyone is going to feel completely recovered within that 30 days. So that number doesn't necessarily reflect that everyone who's counted in there is feeling totally back to how they were feeling before they had COVID-19. But there are actually three pieces that go into that. So we do have some people who are actually initially reported as recovered by a local health department. And then we are also counting people who have completed their isolation period, and that's documented. That's one of the dates we use to help calculate that. And then we look at the 30-day time period where we don't have those dates, and that's how we're getting that information. And what we really think is, in terms of providing that historical data, it's actually more important to look at the cases over time. And we want to epidemiologically look at what the new cases are, what the trajectory of our new cases is. We think that really is telling the story of COVID-19 in Wisconsin and where we're going a lot more than that recovered number, because it can be reported at different points in time for different patients, and different people have different paths to recovery as well from COVID-19.
Thank you, Will. Now to Stephanie Hoff from WisPolitics. Stephanie?
Hi, my question has been answered. Thank you so much.
Okay, thank you. Now to Megan Hart from Wisconsin Public Radio. Megan?
Hi, thank you so much for taking my question. It's for Secretary Palm. I'm wondering, the Sheboygan County Public Health Department sends out an update every day. In their most recent update, they suggested anyone with symptoms of COVID-19 get tested. However, they said if you're unable to get tested due to the limited supply, they suggest that you self-isolate. I was wondering if you have concerns that there are people in Wisconsin right now with symptoms who are unable to get tested.
I certainly have not heard that anecdotally, and I do think it is really important if you have symptoms to get tested. And the first call I would make is to my primary care, to my provider, to access a test, and then obviously we have community testing sites for those who are unable to receive tests through their primary care provider, either because of their testing supplies or because maybe they don't have a primary care provider. We do want to make sure everybody has access to a test, including those without insurance or without access to a primary care provider. But Traci, have you heard of any reports of symptomatic folks unable to get tests?
No, I have not heard any of those reports either at this point.
But I do think, the idea that if you have symptoms, that you stay away from other people is sage advice, right? Whether you ultimately you have the cold or a flu, you don't want to spread that either. But we don't want to transmit COVID-19, and so if you do have symptoms, I think the safest and wisest course of action is to limit your contact with other people to make sure that we are limiting the spread of this disease.
Thank you, Megan. Now to freelance journalist Suzanne Vitalis. Suzanne?
Good afternoon. Governor Evers, this is for you. I live in a small town in the northwest corner of the state. People here never thought COVID was a big deal, and now cases have skyrocketed here in Burnett County. But even people working in the local pharmacy are not wearing masks. It is and continues to be a political divide. What do you say to them?
Well, the same thing you just alluded to is that it's the reverse of that. It is not a political thing. It's unfortunate that there are people, pharmacists, for example, in northwest Wisconsin, that would think that it's okay not to have a mask in a store. That's just unacceptable, and it's not we're taking away their business. We're trying to keep them safe, and so to me, it's not a political issue. And the fact that about 70% of the people in Wisconsin feel the same way, there are some Republicans mixed into that group for sure, and independents, and of course Democrats, but. It's not political. It's science. We have a president saying that we should wear a mask. I hope he does when he comes to Wisconsin next week. And so, if you want to follow an ideology, you got plenty of people that are in leadership positions in the federal government that are telling us wear a freaking mask.
Thank you, Suzanne. We have time to go back to some of the reporters who weren't able to connect earlier. We'll start with Todd Richmond from the Associated Press. Todd? Okay, moving on then to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Go
ahead, Victor.
Thank you again for taking the call. I appreciate it. We saw this past week that the Big Ten, of course, chose to forego the fall season with sports. And as we take in the added factor of the fall, having the flu season in there as well, this question is for the health officials. I'm wondering, is it the recommendation that as the NFL and the Green Bay Packers look at their season, is it your recommendation that they do not hold, that they forego having fans physically at Lambeau Field for their home games this season? Thank you very much.
I think as a general matter, we are not encouraging mass gatherings, right? A concert, a stadium event, generally speaking, is a mass gathering. It's hard to physically distance in a scenario like that. And as we are looking at the tools that we have to combat COVID-19, wearing a mask, physical distancing, the hygiene as it relates to hand washing, and those things that we have talked about from the very start really are the only tools we have to stop transmission and slow the spread. And so we want to make sure we're doing all those things in conjunction with each other to make sure we are protecting Wisconsinites as much as possible.
Thank you, Victor. Now to Katie Anderson from WBAY in Green Bay. Katie? Okay, and finally to Nate Phelps from Spectrum News. Nate? Okay, well, that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.